Surgical Radiography. Purpose of radiography in the OR. The main purpose of radiography in the operating room is for the surgeon to view internal structures of the body so that he or she can perform the operation correctly, such as proper placement of any hardware or lines or removal of any anatomic structures or abnormalities. Knowing your surgical team. Knowing your surgical team is just as important as knowing your own equipment. The surgeon, the certified surgical technologists and nurses, as well as the patient are all on your team as a radiologic technologist. Upon walking into the room, the first task that the surgical team should complete is confirming the ID of the patient and which exam needs to be done. After confirming the patient's ID, the radiologic technologist should perform the exam quickly and accurately while having good communication with the surgeon so that he or she can continue operating. Surgical attire. The OR team is expected to wear a clean set of surgical attire when beginning each shift to reduce the potential of contamination. Protective eyewear, shoe covers, and gloves should be worn if there is a possibility of coming into contact with patients' body fluids. Masks should be worn at all times in the operating room to protect the patient and the worker from cross-contamination. Caps should always be worn in and around the OR to contain the team member's hair. Radiation and ID badges must be worn at all times to track radiation dosage and verify the employee's identity. Keeping the sterile field. One crucial aspect that separates surgical radiology from all other modalities is sterility, or being free of all microbes and bacteria. Determining what is sterile versus aseptic is actually very simple. If it's blue, then it's sterile. As radiologic technologists, we are not sterile members of the OR, but the equipment we use must be draped within a sterile bag and placed into the field around the patient. Standard etiquette and practices must be followed in the OR to keep the sterile field maintained. One should never reach over the blue draping unless he or she is sterile, as will contaminate the field. Always make sure the area of interest is covered with sterile drapes before carefully placing the C-arm. Communication is also very important when maintaining the sterile field. Always let the surgeon and nurse know when you are moving and walking behind those who are sterile. This helps prevent accidental bump-ins that break the field. Another part of communication is being honest and not afraid to speak up if you think the field has been broken. Knowing your equipment. The radiographer should be well informed and familiar with the equipment he or she will be working with. Most radiographic and fluoroscopic procedures in the OR are performed with mobile equipment. Mobile fluoroscopic units, referred to as C-arms because of their shape, are the most common imaging equipment used for surgical procedures. On one end of the C-arm, there is an X-ray tube for producing the exposure, and on the other, an image intensifier or flat panel detector for receiving the exposure. A monitor must be coupled with the fluoroscopic unit to display real-time dynamic frames and static images for the surgeon to view. Radiation safety. When operating radiologic equipment, a radiographer should set parameters that will produce an appropriate image while also limiting radiation exposure. The radiographer and surgeon must also work together efficiently to minimize fluoroscopy time. The radiographer and surrounding OR team members should wear lead aprons and thyroid shields while radiographic examinations are being performed. Lead is an effective material for absorption of X-rays and protects the body from excess radiation. Workers in the immediate area should also stand as far away as possible from the X-ray tube, as the most effective method of radiation protection is distance. A general rule is that radiation exposure decreases by the factor 1 increases as distance squared. The recommended configuration for fluoroscopic equipment is that the X-ray tube always be placed below the patient and the II or FPD placed above. With this configuration, less radiation reaches the facial and thyroid region of a person standing next to the patient. One should also attempt to stand at a 90-degree angle to the radiographic equipment and patient to avoid excess scatter radiation exposure. As you can see through all these things, radiography is not just simply pushing a button, it's an integral piece of the operating room.